as well start, even though there's probably some more people connecting, because you're not here to listen to me, you're here to listen to our fantastic group of speakers today. This is our, I think, third, I guess, event. We're trying to have one a month in lieu of our in-person conference that was supposed to happen in May. And today I'm really pleased to have a fantastic group of women that will be talking about advocacy. As we've been learning, as scientists, it's really important for us to advocate for our health and for women's health in particular. Before I introduce the speakers, I want to acknowledge that some of us, at least, I'm hosting this event on the traditional, ancestral, and unceded territories of the Coast Salish peoples, including the territories of the Musqueam, Squamish, and Tsleil-Waututh nations, and I'm very lucky to live, work, and play on these lands. And I just want to make sure that we all just take a moment to reflect on this. We're also very happy that we have sponsors for this. Without them, this wouldn't be possible, particularly Michael Smith and CIHR Foundations, but also LZVA, Women's Brain Health, and Elizabeth Ryda, who gave us a generous donation. Follow us on Twitter, which is on the next slide, with the hashtag Women's Brain Health Conference, WBHC 2020. We'll be asking questions through Slido, so just put Slido in your Google. Probably many of you are very familiar. It should be in your invitation as well. And the event code is 95102. And also join us on Facebook. And the most important part is consider donating to support our efforts. If you're happy with us, of course. So first up, we have, and I'll stop sharing while I introduce our first two speakers. We have Patricia Thomasay and Jamie Charles. See, I should have asked how to pronounce your name.
Charlebois.
Charlebois. See, I wouldn't, and I still didn't do this very well. But so they're two moms on a mission advocating for perinatal mental health strategy. In a short time, they've gathered a string of diverse team experts from across Canada to support their efforts. And they're co-founders, and I'll be telling you a lot about this, of the Canadian Perinatal Mental Health Collaborative, a group of advocates lobbying the federal government to create a perinatal mental health strategy. And just to tell you a little bit about each of them individually, Patricia I met a few years ago, actually, when she gave a talk at another conference. And she's been writing, previous to this life, has been writing extensively on perinatal mental health for Huffington Post and other publications. She was a reporter for CTV News and CBC, and I read on her LinkedIn bio that she did this in Vancouver, Toronto, Timmins, and Thunder Bay. She has a following of over 13,000 on her Maternal Mental Health Matters Facebook page, and 3,500 members on her Postpartum Depression and Anxiety Facebook group page. Jamie is the Perinatal Mood Disorder Coordinator at Aurelius Soldiers Memorial Hospital and Regional Volunteer Coordinator for Postpartum Support International. She holds a Master of Science in Nursing and a Perinatal Nursing Certificate from the Canadian Nurses Association. Her work experience includes 16 years of clinical nursing. And I have fun facts about both of them because it's great to listen to all of that. But it's also nice to know some fun facts. So for Patricia, she was on a cooking show called Fearless in the Kitchen, where Christine Cushion taught the most awful cooks in Canada how to make their favorite meal. Thank you for sharing that, Patricia.
And it hasn't helped me at all. Still terrible.
Well, we'll have to be the judge of that in a later show. Jamie, her fun fact is that she broke and partially dislocated her left arm on her first date with her husband, who found her klutziness endearing. And she wanted me to tell you that that was because they were rollerblading, but I don't know. There could be some other things where she broke her left arm. Some other activities. Okay, without further ado, please let me welcome Patricia and Jamie.
Okay, I'm just going to share my screen here. So thank you, Lisa, for that wonderful introduction and for inviting us to speak today at the Women's Brain Health Virtual Conference Series. So today, Patricia and I are mums on a mission, getting the government to enact a national perinatal mental health strategy through the power of media and advocacy. And of course, my slides won't change. There we go. So we're going to be talking about how perinatal mental health is currently a national crisis. We'll let you know what the Canadian Perinatal Mental Health Collaborative is and what type of programming and advocacy and efforts we are doing. Why now? Why is perinatal mental health more important now more than ever? We'll talk to you about some of our messaging through media and what you can do to help. Patricia.
Okay, yeah, sure, sorry. We only practiced this a million times. So my name is Patricia Tomasi. I'm the co-founder and communications director at the CPMHC. As Lisa mentioned, I used to write about maternal mental health for HuffPost Canada. I'm a former journalist, now full-time advocate and mom of 2, and I have lived experience. I have been through prenatal and postpartum anxiety, depression, and bipolar disorder.
And I'm Jamie Charlebois. I am the co-founder of CPMHC and the research director. I come from a medical background, but I also have lived experience. I have a 15-year-old daughter, coming up to 20 years married with my husband, so he stayed with me after my klutzy moment. And I suffered from undiagnosed and untreated, now I recognize, postpartum depression, anxiety, obsessive compulsive disorder, and PTSD.
And how Jamie and I met, it was kind of serendipitous. I was researching for an article for Huffington Post, and I found Jamie. She's the only perinatal mood disorder coordinator in Ontario, so I wanted to interview her. I found her, and then I found out she lived in Barrie, where I live, and then we found out we only lived a couple kilometers away from each other. So we kept in touch, and our mutual love of perinatal mental health, you know, we were wondering why no one was advocating at any level, municipal, provincial, national. So we just said, F it, and we decided to do it ourselves.
So there's a lot of different acronyms and short forms when we're talking about this topic. So we just wanted to define that perinatal is the time period from conception to 12 months after birth. And there is lots of research that's coming out to say that that could be extended for several years past, especially if untreated. PMADS is perinatal mood and anxiety disorders. Many people within the audience will know about the baby blues, the normal emotional ups and downs in the first couple days to weeks after the baby is born, that many, and honestly up to 85% of women experience. And the fact that PMAD is a mental illness that manifests itself in a variety of diagnoses, such as pre- and postnatal depression, anxiety, PTSD, OCD or obsessive compulsive disorder, bipolar disorder, eating disorders, and on the very rare occasion, 1 to 2 women per 1,000, a postpartum psychosis.
So we became Canada's first and only perinatal mental health advocacy organization, and we're really proud of that. And now Jamie will tell you our long-winded sentence, which is our mission.
So our mission is to lobby the federal government to create a national perinatal mental health strategy that will provide direction, policy, and funding for improvements to perinatal mental health, including universal screening and timely access to treatment for women and men during pregnancy and the postpartum period. So in our very early efforts, we created the National Committee, which that was our first campaign, and we recruited, and now we have more than 40 dedicated researchers, people with lived experience, academics, healthcare providers, who are representing all of Canada, each territory and province.
And we also have a social media ambassador committee, which is growing day by day. There are lots more people on the committee here. We couldn't fit them all, and they help push our campaigns over social media.
So current state, in Canada, we do not have a strategy, mandates, or directives to dictate how to properly assess, diagnose, treat to remission, perinatal mental illness. Across all of Canada, there's inconsistent access, and this has been phrased as a postal code lottery by Linda Rankin in Northern Ontario, that depending where you live, you may or may not have access to specialized treatments and specially trained healthcare providers. If you are able to access these types of treatments, there are very long wait lists. And we're way behind other countries such as the UK and Australia, where they have countrywide strategies and funding. And some parts of the US are doing a fantastic job also.
So again, why did we decide to start the CPMHC? I'm not going to read the points on the slide. You can have a look there. I'm just going to let you know, in addition to those points, stigma, lack of public and professional awareness, and leaving the onus on mothers to reach out for help results in only 15% of moms receiving professional treatment. There's also different cost estimates that have been done. So it's estimated that, you know, for untreated mothers and children affected by perinatal mental illness, it's estimated to be $150,000 per mother-child dyad, which can be reduced to $5,000 with adequate screening and treatment. 85% of mothers are not properly treated, and that is an estimated economic cost to Canada of $11 billion. There has been preliminary results that we've seen from one of our committee members, Dr. Leanne Tomfor, on what's been happening with PMAD rates and COVID-19. So she's seen that PMADs have doubled internationally. Over 30% of women are screening above 13 on the Edinburgh postpartum or postnatal depression scale. And there's a clinically significant increase in rates of anxiety, 29.8%, and depression, 26.4%.
So bottom line, the CPMHC wants nothing less than universal screening and timely access to treatment for women and men during pregnancy and the postpartum period. Through social media campaigns, petitions, and tremendous support from parents across the country, we are working towards a strategy that will leave no one behind.
And so we do that through major campaigns. We've really just come out, we've talked about forming the CPMHC for a couple years, but we launched publicly in January of 2020, not knowing that, you know, a pandemic would hit. So the first campaign that we wanted to do that we did was we launched an e-petition. It was presented virtually to the House of Commons by MP Heather McPherson of Edmonton Strathcona. She sponsored our petition, and her story was made. It was the first time a petition was submitted for a national perinatal mental health strategy. Unfortunately, the response from the government, which we got back in July, was lackluster, but we'll talk about what we did about that response. We'll go to the next slide. So to let people know about that campaign, we launched a huge social media campaign called Now More Than Ever. So we used the hashtag Now More Than Ever. In a pandemic, we knew that PMAD rates would rise. We knew that now more than ever, Canada needed a national perinatal mental health strategy. So we invited parents, we had celebrities, we had Juno Rinaldine, Sarah McVie from Working Moms, and we had comedian Jessica Holmes, we had MPs, MPPs, mayors from across the country contribute a video telling us why, in their own words, why they also felt that we needed a strategy now more than ever. So the video is 12 minutes long. We're not playing the entire video. We're going to play 2 minutes of it. If you want to see the whole video, you can go to our YouTube page. So we'll just play the 2-minute video that we have here now for you.
Now more than ever.
Now more than ever.
Now more than ever.
Now more than ever. We need to create and we need to implement a perinatal mental health strategy so that no other mother, no other family has to experience what I did.
Mental health is the most common obstetrical complication, with 1 in 5 mothers and 1 in 10 fathers experiencing anxiety and depression in the pregnancy and postpartum time.
Hi, I'm Dr. Jody Paluski. I'm a neuroscientist, therapist, and a mom. Now more than ever, we need support for those moms during pregnancy and the postpartum period to support their mental health as they transition during this difficult time.
I think what I'm struggling with, I might cry. But it's really weird to not, to even think that, okay, my mom can't come with me, but it's just sad, like she can't even visit me when I'm here like this, and then after, for sure not.
Hi, this is Morag from North Vancouver, BC, and my message to new parents is that whatever emotions you may be feeling right now are real and valid and honored.
I struggled with depression for a good 9 to 10 months after my son was born. I felt ashamed and didn't know how to cope or process my very scary thoughts and feelings. I am on the road to recovery, but I still struggle with depression some days.
Hi, my name is Christine, and I'm from Strathmore, Alberta.
Hello, everyone. My name is Nicole Weston. I'm from Barrie, Ontario.
Hi, my name is Kayla Bell. I'm reaching out from Saskatoon, Saskatchewan.
Hi, I'm Nikita from Victoria, BC.
Hello, my name is Tanya Hales, and I am the founder of Black Moms Connection here in Toronto. Specifically, Black maternal mental health matters to me because access to services and supports is less than for us as well, and we need everyone in the community to be whole and healthy.
So we encourage you to watch the entire video that we have on our YouTube channel. And so when we were not exactly thrilled with
the response, more than ever.
Now, more than
we're just going to play it on a loop for the rest of our presentation. Our next campaign was #EmailYourMP. What the government responded with was a list of programs that they had, which some of them touched on perinatal mental health. Some didn't even address perinatal mental health at all. So one of our national committee members called it a dog's breakfast. So we like that quote. We kind of knew the government wasn't going to come back and say, yay, let's work on a national strategy together. We knew this was probably going to take some time. They need to know, we need to continue being loud. They need to know that we're serious, that this is an issue of concern and importance to parents across Canada. So we wanted to build on this campaign and launch an even bigger one, which Jamie's going to tell you about now.
Yeah. So following our petition campaign, we were hoping to work with the government to work on the first steps of creating our national strategy, which in our minds would be the study to lay the land to figure out kind of the state of perinatal mental health care in Canada. So who's screening, when, where, why, who's getting treatment, who isn't. We weren't going to wait for the government to act, so we took the next steps and we went ahead with our biggest campaign yet. And it's happening right now. So we will present a report to the government with our findings from this #survey for change, which I'll tell you about, and with our own recommendations to positively impact perinatal mental health care for all Canadians. So over the summer, our national committee, we created a survey, which we received Research Ethics Board approval through the University of Calgary, and our primary investigator is Dr. Leanne Tomfor. So what we really wanted to understand is what healthcare providers are doing in regards to perinatal mental health. Are they doing different screening and treatment practices? And what are they doing when they identify women or men that are struggling? So really looking at what gaps exist and what we can do to improve those. So in phase 1, we launched at the beginning of October for World Mental Illness Awareness Week. And we're just going into phase 2, where we're really hoping to get lots of different responses. I do have some preliminary data that I would like to speak to you about. So there's just a couple qualitative responses. This one's from a physician. So this physician says there's so many myths and poor advice for pregnant women and families. We have to do better. This physician thinks that we need more peripartum mental health support in doctors' offices. improve social networking for new parents, remodeling of care. So we set up more fourth trimester classes, more lactation support, and really look at the social determinants of health, and improve knowledge and understanding of childhood trauma. A nurse said that if we invest money and resources into families within the first year of life, we can greatly impact the development of infants for the positive if their primary caregivers are provided timely and appropriate support. This should be a luxury provided to all Canadians, no matter their geographic location. And for those of you that like the numbers, so far we have 372 responses. And what they have told us, these healthcare providers, is that only 12.1% have mandated screening, that 86% agree that there are issues accessing treatments. Half of the perinatal healthcare providers said that their clients had to wait for 2 months or more for specialized therapy. 37% thought that available perinatal and postpartum services were not sensitive to the needs of persons from diverse backgrounds. 68.3% felt that their clients had increased difficulty accessing services during the COVID-19 pandemic. And 59.9% felt that perinatal mental health care services do not fully meet the needs in Canada.
How are we doing for time? I just want a little check-in.
We have a couple minutes.
Okay, so we're gonna fly through the next slides. In conjunction with our survey right now, we are putting together a perinatal mental health anthology. We've put out a call for parents to submit their own stories in their real words. We also are publishing chapters. We're having healthcare practitioners write a few chapters for us. The book is going to be a guide as well as provide real stories for parents across Canada. We're doing this in conjunction with our survey. We're planning an event we hope to tell you more about in a few months, where we will present all of this work to MPs across Canada. So if you have a personal story to tell, we would love to have it part of the book. Our submission deadline is coming up. It's December the 10th, but you can do it. Just contact us. We have various campaigns that we run throughout the year. I won't spend time on this slide, but we're always running a campaign.
Earlier this summer, we decided that we wanted to recognize the phenomenal work of Canadian researchers in the field of perinatal mental health. So we have been doing the hashtag Researcher Spotlight. We've had half a dozen submissions. This one is Dr. Leslie Roos from the University of Manitoba. So if any of you are interested in having your Canadian research highlighted by CPMHC, please let us know.
And of course, we also reach out to traditional media anytime we do a campaign. We've had excellent responses from media, better than I had hoped. Of course, we still want to do more, but we've been on CBC, local, local coverage, and we even have had some national coverage.
So what can you do? Please join us if you're interested in being part of our national committee or a social media ambassador. Take the time to fill in our survey if you're a healthcare provider and share it with your contacts. Follow us on social media and send your perinatal mental health stories to Patricia. So we are on Facebook, Instagram, Twitter, and LinkedIn.
And we'll just end with this quote. NDP leader Jagmeet Singh is the only party leader who has agreed that we need a perinatal mental health strategy. He said new parents shouldn't have to worry about perinatal mood and anxiety disorders while taking care of their newborns and growing families. Because of that, we got a national story during the federal election in the Huffington Post, where Jamie and I were interviewed. And of course, we want all parties to agree to a national strategy, and that's what we'll continue to work for till we get it. Thank you.
Thank you so much, everyone.
So I know we've muted everyone, but you know, you can always do a reaction, I think. Yes, thank you, Travis, for showing that you can do a reaction, and I can clap. So thank you very much. It was really eye-opening. The survey results too, the initial survey results are really interesting. One of the, and I'm just going to remind everyone, you can submit your questions through Slido. So we'll do a couple of minutes now, and then we'll ask Shirley to speak, and then we'll do some more questions afterwards. But one thing that I was particularly taken with was the quote from the physician, I think, and because I'd already had this question written down for myself, which is, when I was pregnant a million years ago, my kids are in their 20s now, one thing I really noticed was how much attention there was, this is anecdotally, now I studied this partly, but how much attention there was on the pregnant woman. So while I was pregnant, lots of attention, lots of questions from the doctor. I was nauseous, and they kept asking, pushing pills on me, even though I was just nauseous. But then as soon as the baby was born, all the attention went on the baby. Like nobody asked me any questions about how I was doing. And then I did a little search very recently of books, like what to expect when you're expecting. And then there's a what to expect in the first year. But it's all about, again, pretty much all about the baby. There's a little bit about the mom. But that sort of disconnect with how much attention there is on the pregnant person versus during the postpartum period is really stark and crazy. So I do think a lot of attention needs to be on that postpartum, that fourth trimester, especially. Of course, we all need support all the time, but that's where I think we really lack. Is that something that your research is sort of agreeing with, that people understand from an advocacy level, would you say?
Yeah, absolutely. And unfortunately, not much has changed. Like, here we are 20 years later after your kids were born, and we're still, once the baby is born, the baby becomes the focus. And it's really unfortunate because, if we want happy, healthy, resilient families, we need to put mom on a pedestal. We need to prepare her and support her and make sure that she can be the best that she can be to take care of everybody.
Yeah, absolutely. There's a question on Slido, and it's about the allopregnanolone, brexanolone, the new treatment for postpartum depression. And so the question is, and I really want to answer it, but I will let you answer it. How effective is it? Is this approved for use, if you know? And then if not, is there any progress in implementing it?
Yeah, it's not in Canada yet, unfortunately. Definitely, we have emailed or connected with the primary investigator of that study. We are involved with another study of hers too. I've heard fantastic results in the States. I can't wait until Canadians have access to that type of, specialized treatment.
Yeah, the one thing about that from a practical point of view is that it requires 60 hours of infusion. So you have to go to the hospital. And what's interesting when you actually look at the curves for the symptom remission for it is very effective. But you also see that in the placebo group, they come down really dramatically too. And so I also think that shows us that bringing women into the hospital, giving them a lot of support and attention just for 60 hours can really improve mood. I don't know how long that lasts, and I'm sure with brexanolone it will last longer, but that would be another question. I think that would be really interesting.
Absolutely. And if I could just jump in and say something else we don't have in Canada, which really helps decrease postpartum depression and perinatal mental illness, are mother-baby units, MBUs. So that's something else that we're hoping to bring to Canada.
It's kind of crazy. We always think that we're so ahead of the game here in Canada, but we're not. And it also struck me in your comments in your presentation that a lot of countries have perinatal mental health strategies and we do not, and that's almost criminal. But well, thank you very much for your efforts. I'm sure there'll be some more discussion later, but we'll have to keep the conversation going. So thank you. Also shows us as scientists how important the campaigns are. And hopefully we'll have some good news to share about moving the needle in Canada. And now we're going to go to the other side of lifespan. Maybe not the other side, it's but to Shirley, who is not a mom on a mission, but she is a mom, and she is on a mission, and her mission is to empower women to navigate perimenopause and menopause and beyond with confidence and ease. She's the founder of menopausechicks.com, and if you don't know about it, I urge you to look that up. And it's a popular private online community. In 2018, she published her first book, Moquita, which reached #1 on Amazon and Women's Health. She has a lot of fun facts, but we only have time to pick one or two. I actually picked two. One was, before there was an internet, she used to sell condoms by mail order, which is a story. I'm sure she's got lots of stories to tell. And then I thought this is an homage to Schitt's Creek, because she grew up in a motel and that her parents owned, and her family of four all shared one room. And I think many of us can imagine how fun that would be. That would be after watching Schitt's Creek. And if you haven't seen that show, you should watch it. Take it away, Shirley.
All right, thank you, Lisa. The other fun fact, while I'm just sharing my screen here, is when I started my research on perimenopause and menopause, I remember like one of the first people I stalked was Lisa. I saw that you were nominated for a YWCA Women of Distinction Award, and I was like, I am going to meet her one day. And so I just want to say what an honor and privilege it is to be invited to your platform. It's amazing. Okay, I'm gonna set my timer and tell you that this is not normally the presentation that I give. But I wanted to jump at the opportunity to speak to a list that I keep on my wall here in my office, and it's called Menopause Unspoken. And it's all of the things that are not being said whenever we talk about menopause. So I think that whenever I introduce myself at a backyard barbecue, people probably immediately have some sort of idea of what I do. They have inherited a connotation of what menopause means, or they think that maybe I, Dr. Bash, or they have their ideas, right? That's not what I'm going to talk about at all today. So just thank you for the kind invitation. I usually start out my presentations by saying, hi, I'm Shirley and I'm a menopause chick. I am 53 years old. I started Menopause Chicks, the website, 8 years ago today. So this is a really cool way to celebrate that. We have an audience of about 100,000 women, predominantly in Canada, although we touch 10 English-speaking countries. And I spend most of my time in a private online community, as Lisa mentioned, on Facebook, where we have 25,000 members. Our mission is to empower women to navigate perimenopause to menopause and beyond with confidence and ease. And when I started Menopause Chicks, I thought all I needed to do was crack open the conversation. I was under this assumption that women just weren't talking about it, and my gift to the world would be to crack open the conversation. But what I quickly learned was that we need, in order to achieve our mission, in order for women to navigate, I mean, even the words confidence and ease aren't always associated with perimenopause and menopause and postmenopause. So in order to do that, we need to actually change the conversation. My vision, I am a mom on a mission. I often share a story about how my vision is my daughter, who's now 17 and in grade 12, that by the time she and her friends turn 35, that they will look back at us and go, what, that was even a problem? That they'll have it handled. And the other inspiration for Menopause Chicks is my son. He just recently turned 20, but when he was 12, I was literally losing my shit on him every single morning. And it was usually about something that wasn't important at all. I was coming unglued because he wanted to wear shorts to school in the middle of winter. And then I would retreat to the bathtub, rock back and forth all day because I was telling myself I was a terrible mother. And it was actually that experience of my hormones being so out of balance and experiencing stress and burnout like I had never imagined, that was leading me to become a mom that I had never imagined. And so I think that like our previous presenters, often it is our own life experiences that lead us to this work, and I'm very grateful to be doing it. So what do we do? Well, we offer women quality health information. And I like to answer the question, what is a menopause chick, by saying it's any smart, savvy woman who likes to be proactive with her own health. We also connect women to trusted health professionals who can support their journey. And then we provide a community that has her back. Now, I'm not sure I call myself a women's health advocate, but I'm not actually sure I am an advocate. I don't advocate to government like some of my colleagues in the UK are currently doing. I haven't yet advocated to have the curriculum at the Family Medicine School of Medicine, at UBC. I haven't advocated to have that change. And so I think really what I am is a concierge. And I'm really developed the skills to direct women towards the information, the healthcare professionals, and the support that they need. Now, today's presentation, Menopause Unspoken, is not a list of what your mother didn't tell you, and it's certainly not doctor bashing, and it's not about all of the media innuendo that we hear from media, such as hot, old, tired, bitchy, and fat. It's not that. That's a presentation for another day. Although we have had some success stories in this area, which I can share with you in the Q&A if we have time. It's also not a presentation about all of the innuendo, myths, and misconceptions that exist around hormone therapy. But I know that this conference was kicked off with Carol Tavers, the author of Estrogen Matters. So you can learn a lot from what Carol and her colleagues have taught us. It's not a presentation about why you should moisturize your vagina, but you should, because it's connected to your brain health. And it's not a presentation about how there is sex after menopause, sometimes even with a partner. What it is it's a collection of questions that I have been curating, 17 things that are not being said about menopause, and particularly how it's keeping women from living their healthiest midlife. The first one is that women are struggling. We need a Volvo for women's midlife health. And what I mean by that is that Volvo owned the seatbelt. They took ownership of the fact that cars needed seatbelts and seatbelts saved lives. I'm not sure who else is laying awake at night thinking about the struggles that women are having, not only in navigating their hormonal journey from the reproductive years through perimenopause to menopause and beyond, but how difficult it is when they do recognize that they need support to get the support that they need. The second unspoken truth is that doctors are not generally trained to say, that's not in my wheelhouse. Often they're trained to say, oh, you have a problem, I'll reach into my toolkit. This is what I have in my toolkit, prescription pads, surgery, and I'm going to fix it for you. And I'm just trying to imagine if we did have a culture where doctors said, or, you know, if I took my car to my dentist and said, could you fix this? My dentist would likely say, oh, that's not in my wheelhouse. You knocked on the wrong door. But typically what I hear from women in my community is that they are leaving their doctor's appointments either dismissed or disappointed. And in fact, there's a great piece of research that came out last fall from the BC Women's Health Foundation that showed that over 50% of women aged 45 and up were leaving their medical appointments dismissed or disappointed. And the two predominant concerns that they were at their doctor's office that day were menstruation or menopause. The unspoken truth number 3 is that, I don't know about you, but everyone wants to believe in the magic wand. And what we really need when we're taking care of women's health, women's brain health, women's hormonal health, is we need the solution to the Rubik's Cube. Unspoken truth number 4 is that as a society, we have a greater appetite for managing symptoms versus investing in our health. Now, I'm going to pause because this is a biggie for me. I use the word invest a lot. Women in my community are very in tune with saving for their child's post-secondary education or investing in retirement funds, but they're not always aware that what we do now in perimenopause, menopause, and beyond is actually an investment in our future brain health, bone health, heart health, and vaginal health? And what if we had a campaign that what if every February 28th, the commercials on TV came on and said, this is the time of year where you have to stop everything that you're doing and invest in your health, because it's actually going to significantly reduce the rate of Alzheimer's. Another unspoken truth is that we are going to put a woman on the moon in 2030. There is a mission to Mars being planned right now with a well thought out health plan for its astronauts. But here on Earth, as I mentioned before, women are walking away from their health questions, their health professionals, and their health concerns, feeling like they need to suck it up. This is a glaring gap in women's health. And I see the needle moving a little bit, but we've got some huge challenges ahead of us. And if, we were to do the math on the budget that NASA has for this particular mission, we could balance the hormones of a lot of women. Another really sad or concerning thought for me is that too many women are making health decisions based on headlines and hearsay. And this is really important because, media do their fact checking by searching Google. So if you want to find it on the internet, it's there. And that's really unfortunate, especially when we have like generational myths and misconceptions trickling down to our daughters and our granddaughters, thinking that being a woman means you must suffer, you must endure pain, there's discomfort involved, you must be making it up, or you have to suck it up. This is a new one for me, and it's really, it's a thought I had before the pandemic, but now even more so. Billions with a B of dollars are being invested through startups, entrepreneurs, venture capitalists into telehealth. And they are all patting themselves on the back right now about how amazing telehealth is. But here's the thing. Hormone balance is not taught in medical school. So it doesn't matter whether I am seeing my doctor who may not have the education or the experience or the expertise. It doesn't matter whether I'm seeing him or her in person or through a Zoom call. Telehealth is not the answer to navigating perimenopause with more confidence and ease. Now, this is a tough one for me because I'm a huge Oprah fan. I've supported her for decades. She's been my 4 o'clock goddess growing up. And right before I did my TED Talk in 2016, the September issue of O Magazine came out with a story on the front cover that said, "Hooray for hormones." And I was like vibrating. I was so excited because I thought, oh my God, Oprah and I think the same about this topic. And then when I opened up the magazine, it was one of those stories that was like, this is what happens to you in your 30s. This is what happens to you in your 40s, 50s. And the images that were in the story were, I was gobsmacked. The image for what happens to women in their 40s was that we lose our brains, that we lose the ability to think clearly. And so they replaced the woman's head with a spaghetti colander. And I wasn't quite 50 at the time. And so when I flipped the page to see what the art director had used as an image for women in their 50s, I was met with this yellow kitchen sponge, which is cut out in the shape of a woman. But I don't know if you can see it or not. It's urine that is all around the bottom half. And essentially, the article screamed that women in their 50s pee their pants. Our language is outdated, the innuendo is alive and well, and the imagery doesn't represent who I am, and it doesn't represent the stereotype that I want to pass on to my daughter. Less than 4% of women experience vaginal dryness. Less than 4% of women who experience vaginal dryness receive treatment. Now, you might think that this is important for sexual health, and you are absolutely right. But the other reason addressing vaginal dryness and preventing vaginal dryness and preventing vaginal atrophy is that we want to sit comfortably, we want to move comfortably, we want to dance comfortably. I have women in my community who tell me that they like summer best because then they don't have to wear their jeans, that they can get by with a sundress because it's too uncomfortable to wear pants. This is about sexual health, and this is not about sexual health. And I want to take that one step further. I believe vaginal health is connected to brain health because one of the first things that women will stop doing when they experience vaginal dryness, UTIs, or incontinence is they will stop exercising and moving. And from that moment on, we are at greater risk for brain health decline. Oh, I need to take a breath. The unspoken truth number 10 is that navigating perimenopause for me probably put me out of pocket about $10,000. If you add up the number of naturopaths that I went to, the time that I took off work, I mean, I don't even know how I would quantify that. And I'm married to someone who has a pretty good health benefit plan. But the truth is that this is a privileged sport. And if you don't have health benefits, if you don't have access to the information or the team of health professionals that I do, you are faced with making health decisions that are probably not only not going to address your short-term health concerns, but have a significant negative impact on your longer-term brain health, bone health, breast health, heart health, and vaginal health, as I mentioned. Number 11, Estrogen Matters. We don't have a campaign yet that says we're the first generation of women to turn 50 and have 50 more years to plan for. This is really important. Our bodies were not designed to live for 3, 4, 5 more decades. Our brains, our hearts, our bones, without the support of estrogen. And, I think probably there's many people in our audience today would know this more than I do, but the impact just on Alzheimer's alone by replacing or supporting our estrogen production is a conversation worth having. Okay, sliding quickly to the end. Marketers want our money. Menopause is a sexy word. If you are an entrepreneur or a manufacturer of something, it shows up in various forms on products, and women buy it, and they buy the product without turning around and looking at the ingredient list. I had a woman from Florida call me just last week. She was gung-ho because it felt like she had just discovered the jackpot of women in midlife, and she was selling a product for hot flashes. And when I actually shared with her what I know and what my research has shown me, she's like, oh, well, I haven't done any research. I just really wanted to sell this to women 45 and up. Marketers want our money. As I mentioned, media use Google to fact check. So when we are sharing articles, and this happens in my community, although I run a pretty tight ship and I don't like sharing articles that I haven't had the opportunity to do a deep dive on. But if you're assigned an article and you want to write about perimenopause, you're going to go to Google, and then there you're going to find myths, misconceptions, and some of the innuendo that I spoke about earlier. And so it's really even more important for us to be those smart, savvy consumers and to be our own best health advocates when we are consuming that information. Number 14 is something that I don't know if anybody's actually thinking about either, and that is that the medical community's lens on menopause only represents 20% of women. So we often talk about perimenopause and menopause as if it's, oh, my doctor has the answer. I'll go see my health team if I have any symptoms. The reality is everyone goes through perimenopause. Perimenopause is not a synonym for suffering or for symptoms. Yes, 20% of women have their worlds rocked upside down by hormone imbalance, but 20% of women sail through. And 60% of women in the middle, of which I would consider myself perhaps part of that group, they notice changes that are mild to moderate. They don't always go to their doctor for it, or they might be part of the percentage of women who do something proactive about it. So when we go to see our doctor as the expert, they're only looking at 20% of the population when they're forming their opinions about women navigating perimenopause, menopause, and postmenopause. Placebo is a really important factor in this conversation because what we tell ourselves has a 30% chance of supporting our health. And that is everything from, the vitamin or supplement that you might pull off the drugstore shelf to what you tell yourself about aging and the aging process and how you want to live your 3rd, 4th, 5th, 6th decade and beyond. Number 16 is that hope is not a health strategy. I like to point this out to women as often as I can because, first of all, I'm guilty. I think many of us are guilty. It's like, yeah, I really hope I don't get osteoporosis. But what am I actually doing today to prevent getting osteoporosis? It's an important conversation. I think it's also one that we need to have with our daughters as well. And number 17 is a phrase that I repeat multiple times every day, and that is, women deserve quality of life. You are worth this effort. How many times have we been told that something is wrong with us, that we need to be fixed, that we're broken? Lots of magazine headlines have tried to convince us that for years and years. And it's really, in my opinion, time for us to pivot, to have that paradigm shift where we tell every single woman in our lives that they deserve quality of life and that they are not to put their health on the back burner, that it's time to put their own name and their health at the top of the to-do list. Whoops, why am I not moving? So, Lisa, thanks for mentioning my book. I called it Mokita because this word Mokita actually found me just before, I was ready to hit send on my transcript. And it's a word from Papua New Guinea that means the truth we all know, but choose not to speak of. So it's like the elephant in the room. And I've just shared with you 17 elephants that have been keeping me awake at night. And I really appreciate your time, but I would love to hear your thoughts, or if there was any one of those 17 that perhaps triggered an idea or some feedback as to where we can go if we truly want to build a new model for women's midlife health. So thank you.
Well, thank you so much, Shirley. I'm going to give you a clap, an audible clap, but the rest of you can give one of the little caricatures. So we have about 5 minutes, and there were a couple of things that that really resonated with me. I won't share them all, although I'd like to. But one is, and I saw some similarities between the two talks, which I'd like to talk about or at least touch upon as well. But one is, when I was going there, this was a long time ago, I'm in my 50s, but before I went through got my period, my mom gave me a bunch of pamphlets. Yeah. Like, this is what because in those days, you didn't necessarily talk about it. Here's some pamphlets, here's some books on it, which I read and took to school, and we all poured over it, all my friends. But there's nothing, at least that I am aware of, besides, some of these books that are coming out like your own, on menopause and the transition. And so one of the first symptoms I experienced, like I thought I was dying, and you know, sorry, maybe I shouldn't be like too graphic, but it was your periods really change and they become really, really heavy. It could be different for different women, but you know, I had no idea. Like I said, I thought I might be actually, you know, dying or something. And so, you know, that lack of information is really, really important. And of course, fake news, fake science. So I think, yeah, how do you navigate that? I guess that's why you created your community, to help women navigate through this in a Volvo, in a nice safe Volvo. I like that analogy.
It's so true. I sometimes say, if this was happening to our children or our pets, we would be the ones to stand up and do something about it. We are fighting, like we're pushing a dinosaur uphill, honestly. It's the conversation around menopause. Well, the term perimenopause was only invented in 1996. 96. So it's super, super new. So before that, menopause was associated with hot flashes and night sweats. And if you still had your period, you know, your doctor certainly wasn't going to have a conversation with you. The changes to bleeding is predominantly one of the most common and popular conversations in the menopause chicks community, because as you mentioned, without adequate information, education, and preparation, women are waking up in their 40s and they are thinking that they're dying or that they have cancer. And that's really sad. It's added stress to an already stressful time of lives. These are the women that are holding up our world right now, right? They're balancing careers and families and aging parents and volunteering in the community. And we've failed to give them the same amount of preparation that we give our children. Like, there's an episode of Anne with an E, I don't know if you watched that show or not, where she gets her period and no one told her. So she actually, at 12 years old, you know, saw the blood and thought she was dying. And I think about that all the time, because I don't know any parent right now that would let their child reach puberty without age-appropriate, well-prepared information, curated education. But it's certainly not happening to us in this age group.
We only have a couple of minutes. We'll go a little bit over, but that just reminds me, Tina Fey has this fantastic part in one of her books about how she you know, knew about periods, but she thought it'd be blue. And so when it came out that it was red, she thought she was dying too. Anyway, it's very funny if you have a chance to pick that book up. So one thing I will say, you know, is I know there's probably many of us that are scientists on the call. So I think there's, you know, the reason why I was really, and there was a bunch of us that really wanted to start this women's health cluster, is because there isn't very much research. So you talked a little bit about how health practitioners and how there's, you know, not much training, and that's true for perinatal mental health and perimenopause and menopause, but there's also very little research in the area. And so, you know, we do need like a campaign to get people to research more. The other thing so we need more funding, we need more research, so then we have more knowledge to disseminate about what works and what doesn't work. Of course, we know some of those. But I'm wondering, like, you know, how do we do this? The other thing that I thought was a commonality that between the two is that, you know, for perinatal mental health, less than 15% I think get treated, and in terms of vaginal dryness, I think you said less than 4%. So these very small percentages of women that are seeking treatment, and even when they do seek treatment, they're probably, you know, met with some confusion on the part of their practitioners, and there's no shame in that. There's just not that much information out there. So yeah, I think we need a tidal wave, right? It's like a tsunami of information, and I don't know how to do that, but you guys are the experts. So how do we do that? How do we get governments and funders and the information to women?
That's why, in addition to the work that we're doing behind the scenes with our extremely talented and devoted national committee and social media ambassadors, I mean, they're doing so much work for us, analyzing their survey results, like Leanne Tomfor, Christine Wu, Amanda Hukias, like I could just name drop all day. They're doing a fantastic, tremendous work, but that work needs to be delivered to the public in, I hate the word layman's terms, but in an easy to understand conversational style. And that's why Jamie and I formed such a great team. She's the brains, I'm the layman. I don't know. I'm the communications portion of it. So that's why we do all these campaigns, because the government will not take notice unless this is an issue to their constituents. So we can do all the work that we want, but unless we bang down on the door and they see more than 2 people, they see thousands of people across Canada that this is an issue for them, then they will do something. We know that. We need moral suasion. And so that's why we do all the campaigns.
Mm-hmm. And Shirley, I would say that you are an advocate because you're an advocate for information and, maybe beating down the fake news stories that are out there. And the other thing that struck me about some comments, and then I think we have to close out, but was that we had in our first symposium, we had Jillian Einstein talk, and her talk was called something like the many menopauses. I think you were there for it. But that also struck me, right? That there's, even perinatal mental health, it's heterogeneous, right? Menopause is heterogeneous. There are many different types of symptoms. There are many reasons why women will go through menopause and also have mental health issues. So it's not even, it's not like this tight box we can fit everything into.
No, we're all individuals, right? And it requires individualized care, but yet we're up against a health system that's quite siloed and not used to individualized care. So.
Yeah, so some of the physicians on the call, reach out and tell us how we can, better educate the community and change the curriculum.
Question about how we do this, though, Lisa, and it applies to all of us in this session, is don't take your foot off the gas. Like, this is my 8th anniversary today. It has not been an easy journey. It's not easy to make money doing this. But it was 1959 when Volvo owned the seatbelt. Before that, we didn't wear seatbelts. I think we have to remind ourselves that it's not that long ago that some things that, our kids just look at me and like, what, you never wore a seatbelt? Like, we have to celebrate that there's milestones in our society where we've been able to move the dial. And this is going to be one of them if we have tenacity and keep our foot on the gas pedal.
Well, I want to thank you all for your fantastic presentations and for keeping your foot on the gas pedal. And for those of you in the audience, please join us in putting our foot to the gas. So thank you so much for your advocacy and for sharing your knowledge, your wealth of knowledge to this group. And with that, we should keep the conversation going, but unfortunately, if it was up to me, I'd have a conference like all day, but we do have to get up and move around a little bit. So thank you so much.
Thank you. Thank you for having us.
Thank you.
Yes. Well, to be continued, I hope, the conversation.
Thanks, Lisa.
Thank you.